Okay, I love seeing all your comments. So anyway, let's get down to it. My name is David Kunashko. I'm the medical director here at BIOFLEX Laser Therapy. We're a photobiomodulation therapy device. I know we always say laser therapy, but the term is photobiomodulation. And now I'm a chiropractor and practiced over 30 years and have been involved with photobiomodulation for over 12 years now with BIOFLEX. So now today's topic is interesting because, you know, we as a company, we actually have treated many animals, humans and other kind. So we actually have a long history of treating, you know, cats and dogs and even horses and other animals as well, too. So I get lots of questions about that, and people email me and call me about their family pet. So I thought I'd do a little webinar. Now, this one is focused on the personal therapy system device because that's what most of you would have at home. Some of you might have professional systems if you're a healthcare professional as well. But today's webinar is more focused on the personal system. If you have any questions, please type them into the Q&A box. In the chat box, you can chat amongst yourselves. Let us all know where you're from, your animal friends. It sounds like some of them have some issues like us humans do. So we'll see if we can help them out. Today I'm going to just, again, I always do a little review for some of you who are new, what these systems look like. And then a little bit about photobiomodulation therapy, just as a recap, or someone that perhaps is new to this. And then a bit of information about the veterinary use of photobiomodulation therapy, or PBMT, a little bit about the research and some key points on that. A really fun little case study on a horse that we know quite well at BIOFLEX, and I'll talk about this miracle horse. And then I'll get into specifically using our systems for your cat or your dog or whatever it is that you want to treat. Actually, I'm at home today, and let me just see if I can grab my. So this is my. I don't know if you guys can see. This is Simba. Okay, I'm gonna let Simba go. That's my family critter right now, and he's helping me with the webinar apparently. All right, so I've had a lot of animals in my history. This is Denver. He's one of my, well, he was a yellow lab and he passed away a few years ago with cancer. And this is my daughter's dog, Finley, just an amazing little dog. I feed a feral cat. I've named him Sylvester. He comes by every night for food. I live out in the country, so this fellow has been with me for about 3 years and comes for his daily feeding. Oh, and all sorts of cats. That's Emerson by the fireplace, and his pal. This is Luna, who I donated to my mom. Looks a little stern there, doesn't he? And that's Darwin, my other lab. He passed away similarly to Denver a couple of years ago. All right, there's the whole gang out looking in the backyard. There you go. And here's another picture. And that's currently, I mentioned Simba, my rescue cat that I just got not too long ago. So interesting enough, when I said I was going to do this webinar, I got a few emails from some of you that may be listening in already. So for Suzanne, that's Brandy and Buffy, her felines. And today I got an email from Nancy with Ruby, who's an 8-year-old, is it Samoa? I'm not sure, with bad knees. So we'll address some of these issues as we go along. Now, our personal therapy system devices, they come in different sizes. They're called the P120 or P180. What makes this treatment kind of unique is that the diodes, now these aren't laser diodes. These are high-powered light emitting diodes, but they're bicolor. So the diode emits 2 wavelengths out of the same diode. They're very specific as far as the wavelengths and the power. that we use, they're stacked very closely together. You can see they're just a few millimeters apart. This allows for a very high energy density. Oh gosh, now I'm watching Simba climb up the kitchen counters. This should be interesting. Let's see if she jumps and he attacks me. And so the point of this intense sort of packing of these diodes is to get a really good energy density for the light to enter the tissues. Now we use two wavelengths, red and near infrared. Red light is relatively superficial as far as its penetration depth. That has to do with its absorption by different photoreceptors or acceptors like hemoglobin and melanin. Whereas near infrared goes a little bit deeper. It can go several centimeters into the tissues. Now, of course, the device is meant for humans, so of course it's pointing to different anatomical structures, but they're going to correlate with your animal as well too, and I'll mention that as we move forward. It's quite simple as far as using the equipment. There's a power on off, a stop button, start pause button for the protocol, and then there's different stages. The stages have different intensities, which have to do with the dosage and have to do with the frequency or pulsations of light. These different levels have different effects on the tissues, so they're not all the same. And certainly if I treat the knee or the ankle or the hand or the foot, the starting dosage will be different and the frequencies will be different from anatomical region to anatomical region. They're not all the same. I think I had that question earlier. So how photobiomodulation works? Well, we're still learning a lot in the research, and it's quite fascinating, but we do know a lot. And part of the reason why it seems to work on so many different types of problems is that it works on the mitochondria of eukaryotic cells. That just basically means a eukaryotic cell is a cell you would find in a mammal or other animals that have mitochondria. And it's the mitochondria that are affected by the light therapy. So, oh, my cat's stuck up there now. He's trying to figure out how to get down. Well, that's his problem, right? So what happens? Oh, there he goes. So what happens is that this light therapy interacts with mitochondria, and when you have tissues that are inflamed, the mitochondria, which produce energy in the cell, are affected, and inflammation reduces the capacity of the metabolism of that cell, and therefore they don't function normally. But when you add light to the mixture, it actually interacts with the mitochondria in a way that accelerates the metabolism. I don't think I'll get into all the details, but essentially that's how it's working. Now, there are two effects of light therapy. One is directly on the tissues that are being affected, that are injured or diseased or what have you. That's where the light is absorbing directly into the cell and having an impact. And that's called a direct effect. And it would make sense that when you're treating with light therapy, that's what you're thinking about. But there's also a phenomenon called indirect or remote or systemic effect of photobiomodulation. And this is where you're treating a large surface area and therefore volume of tissue with blood. And in the blood, of course, are red blood cells, but there's also white blood cells, stem cells, and platelets, and they all interact with light as well. And you can imagine they're not static, they're moving around because they're circulating. And as they're circulating, light's being absorbed, and it has what's called an immunomodulating effect, which has an effect on the immune system, especially in that general area that you're treating. The immune system controls inflammation, amongst other things, obviously. So it seems to have a positive effect on the white blood cells and circulating stem cells that help with underlying and deeper setting conditions or inflammation or injuries or what have you. So when you're treating with light therapy, it's helpful to treat for longer periods of time because this promotes this systemic or indirect effect. So let's get into some of the veterinary stuff. This is a quote from a paper called Photobiomodulation Therapy in Veterinary Medicine. And the quote says, "There's enough evidence exists to justify its educated use in the clinical practice for a myriad of indications." So it is quite commonly used in the veterinary world. Clinical applications for your animal would include the musculoskeletal system, as you can imagine, tendons, ligaments, muscles. We all know if you've had a cat or a dog, especially dogs, They come back limping, or they've chased a squirrel or whatever that they get up to, and they have all sorts of problems. Sometimes it's so serious you have to go to vet and get surgery or rehab or what have you. And I'm not saying don't do that. I'm saying that this might be adding light therapy might be helpful in the recovery or the rehabilitation of that specific injury. It can also be used for nerve-related issues. Compressed nerves, just like humans. You can get disc herniations, compression of nerves, neuralgias, those kinds of things. So it's also very beneficial for that. And we all know, if you've had an animal, oftentimes these animals get skin conditions. I saw a question that I'll address a little bit later on about, I think it was about warts or something, but, animals, just like humans, get lots of dermatological issues, and you can also use it for that. In fact, it's quite effective because there's usually underlying inflammation in the skin. And so it's very helpful to treat that as well. We use it a lot in wound repair, wound recovery, post-surgical. Animals get into things, they chase things, they get injured, they get lacerations, they get all sorts of injuries. And just like a human, we can use the light therapy to help those wounds heal faster than normal. Now, if I were to do a search, which I did, for photobiomodulation, that's PBMT, or low-level laser, low-level light therapy, which is LLLT, and veterinary, I pulls up about 160 research papers on PubMed. And a couple of them I just want to mention here. This particular one is called Photobiomodulation Therapy in Veterinary Medicine, a review. And they make a few interesting points here, that in the majority of animals, obviously the hair coat and the pigment can perhaps impact delivery of the photons to the treatment site. So if your animal has dark skin or dark fur, just like humans, except maybe the fur part, it may in fact have an effect on how that light's being absorbed into the tissues. So, for example, light penetration is highest for light-colored hair or fur. I don't know how you want to refer to it, and lowest for dark-colored hair or fur. And I know in the veterinary world, oftentimes they'll shave an area for surgery, and that actually makes it more beneficial for light to penetrate. You don't have to do that on your family pet, but if the hair is been shaved or removed for surgical purposes or whatever, it helps for treating with light therapy. And similarly, the size of your patient, your animal, will also play a role, and therefore you need to adjust your dosage, just like you might do that in a human as well. Lots of research on osteoarthritis in animals, especially in dogs. This particular research was published in 2022. They looked at 23 dogs with osteoarthritis. They put on this accelerometer. I don't know if you're familiar with these things. They're in iPhones and different watches and stuff that we wear, and it measures movement, I guess you might say, in relation to something that's not moving. And therefore, they're able to track the animal's activity level. And so when they treated the dogs, what they basically found was that the activities increased. The daily step count also increased. It sounds kind of funny, but because we're trying to measure our step count, but they did that same thing for dogs. So they also found that systemic analgesic therapies was decreased by 50% in dogs during the study period. And that's really important. And that's something I stress even for humans, is that the goal of light therapy is to help with your symptoms and hopefully reduce the amount of medication that you may or may not be taking for symptomatic relief, because medication has long-term side effects. And it's really not resolving any issues, whereas the light therapy is actually trying to resolve the issues. So they conclude that light therapy or laser therapy can actually improve the quality of life of dogs with osteoarthritis. This other one, now there's tons of papers. I just did a couple. This one was on photobiomodulation as an inflammatory therapeutic following dental prophylaxis in canines. And again, if you're a pet owner, it's not uncommon for your animal to get some dental work done, again, just like humans, and there can be an underlying inflammation after the work, that kind of thing. So they used light therapy, and they evaluated redness or erythema. And they were looking at inflammation scores, and they concluded that using photobiomodulation, just one single treatment, demonstrated some degree of reduction in oral inflammation and redness or erythema following dental prophylaxis. Okay, so, when I started with BIOFLEX in 2011, I heard about this story about a famous racehorse, and sure enough, I had many opportunity to talk to Dr. Fred Kahn about this particular horse. So I want to share the story with you. Now, it was in our newsletter this past month, or this month actually. So if you haven't had a chance to read the whole story, feel free to do that. And if you haven't signed up for a newsletter, you can do that on our website as well. So Dr. Fred Kahn, who passed away now almost a couple of years ago, he played a lot of golf, and I guess he was a member at the Magna International course. Magna is owned as a company that you may or may not have heard of, but I probably have heard of, owned by billionaire Frank Stronach. And so the two of them both played golf at Magna course, and had a bit of a friendship going on. And I guess one particular day, Fred was listening to Frank Stronach talking about a racehorse, and this particular racehorse was quite a famous one and had won the Breeders' Cup in the Juvenile Fillies Stakes race in 2010. And this horse, in fact, was quite a valuable horse, and Frank, was quite pleased with the horse. But one day the horse went lame, and it discovered eventually that it had a left foreleg tendon injury called a bowed tendon. And basically, it was a really serious injury, one that they felt the horse wouldn't be able to recover from. And so the advice was given to Frank that the horse wasn't able to race anymore and had to retire from racing. Now, the horse's name was Awesome Feather. Awesome Feather was essentially retired from racing at that point. And, Fred Stronach was talking to, Frank Stronach was talking to Fred Kahn about this horse. And I guess Fred Kahn, he was an avid equine fan, you might say. And he was saying, look, Frank, let me see if I can take care of this horse for you, and see if I can get him feeling, or get her feeling better. And so essentially, there was a lot of shenanigans around this particular horse, and apparently some wagers, you might say, about getting this horse feeling better and able to race again. And so we started treating the horse. Now, I didn't personally go there, but at the time when it just started, one of our techs went to the horse stables and was treating this horse quite frequently, along with rehab and everything else. And eventually, the trainer felt that the horse was looking really good, and was pretty surprised, and actually felt that that Awesome Feather could actually race again. And in fact, she did. And she went on to win several other races before she was eventually retired, and I think bought by a Japanese millionaire or billionaire or something. So it just goes to show you that in the veterinary world, if you're persistent along with rehab and using something like photobiomodulation, the results, just like in humans, can be quite remarkable. I gave you the link there if you care to read the entire story about Awesome Feather. Okay, now our history with veterinary use of our equipment goes back, like I say, a long time ago. And in fact, we have a veterinary manual with protocols for cats, small dogs, medium dogs, large dogs, and horses. And the veterinary manual was in part developed by Dr. Chip Godine. He goes by Chip. He's quite a well-known veterinarian in the United States, I believe in North Carolina, maybe, or South Carolina. And actually, Chip was past president of the North American Association for Laser Therapy at the time, or NALT. And so we worked with him and partnered with him to develop protocols with our equipment for these animals. So we do actually have a long history in treating animals. Now, your system is calibrated for humans, obviously, which means that you're going to have to adjust how you use the equipment to treat your cat, small dog, and I'm going to lump those together, and medium and large dogs, I'm going to lump those together. I'm not going to really talk too much about equine. I think someone mentioned about equine. I can answer the questions on that, but I'm assuming that most of you don't have horses at home. Some of you may, but most of us don't have the acreage for horses. But if you're interested in equine, that can be a separate discussion, and you can email me about that as well too. So most of the protocols that are preset for humans are roughly 6 to 10 minutes of red light and 6 to 10 minutes of near infrared light. So in general, you're going to use the anatomical protocol that correlates with your four-legged friend. So if you're treating the mid-back, you're going to use the upper back protocol. If you're treating the hip, you're going to use the human hip protocol, and so on and so forth. There will be some times where you want to treat like a wound healing or skin condition or something of that nature. Then I recommend emailing me, and then I can sort of walk you through how you might alter or change up the protocol to treat those skin conditions. So obviously, it's pretty straightforward how you're going to choose your protocol. Now, in my experience, and I have been treating animals on and off since I was at BIOFLEX, you know, for our own patients, on my animals, and I've done trainings with veterinarians. Cats and dogs are pretty chill when it comes to treatment. Dogs more so than cats for obvious reasons, but they seem to enjoy it. The light pads give off gentle heat. Now, the heat isn't because of the light. The heat is because of the electrical current that's warming up the silicone. And it's a nice warmth to it. And it kind of that relaxes the animal as well, too. And of course, anytime that you're touching or holding an animal, they tend to be pretty relaxed, right? So try to treat them where, you know, or at a time when they're relaxed, as opposed to not being very relaxed. Now, you need to hold the pad against the animal. So again, make sure they're comfortable, make sure it's done after they've exercised or they're in a rested state. You know, for cats, that's 99% of the time. For dogs, maybe not quite as high as that, but don't do it when they're really active or antsy, because it's just not going to work. They have to be relaxed. They have to be in a state where they can be still for at least, you know, 10 minutes or so, I would say, in order to do the treatment. When you're placing the light pad against your pet, I want you to gently move the pad side to side. Now, if you've noticed on our pads, there's little tiny sort of bulbs. They're actually magnifiers, and they stick out from the silicone. And so they displace the hair or the fur. So when you put it on the animal, you want to move it back and forth and side to side. As you're doing that, the little bulbs can get closer to making contact with the skin. Now, of course, the fur will get in the way. And the denser and thicker the fur or the hair, the more difficulty it is. But you'll still get plenty of light into and onto the tissue. And remember, these animals are significantly smaller than humans. So I'm factoring in the fact that you will lose light to fur and hair. And so when you're using it, yes, you will get a lot that's absorbed or bounced off by the fur, but because they're small and they don't need as much energy, it's still very efficient to get these animals treated. So now, if you're treating an acute or fresh injury, I'd like you to treat daily. If it's something that's really acute, like a really fresh injury or something where they've just done it, you can treat twice a day, morning and evening, and then, every day for a while. Eventually going to go down to once every other day kind of scenario. But initially, if things are really bad, once a day for sure. And you can do twice, but make sure it's spread out. And if you're doing twice a day, don't do it twice a day for weeks on end, maybe for a week or so, or until the acuteness has really leveled off. And then you can go to once a day and or every other day. So now, if your cat has dark skin and or dark fur, I'm going to suggest that you add a little bit of extra time to the treatment. And I haven't yet talked about the treatment time, but I will. So approximately a minute or so extra for red and a minute or so extra for near infrared if your animal has a dark fur and or skin, just because it's going to absorb more of that light. Ensure that the fur or the hair is not wet or dirty or muddy. I'm sure you know why that might be the case, especially for dogs, because this will affect the light absorption. Now, medication-wise, typically light therapy doesn't interact with medications, even photosensitive medications, because they tend to interact more with ultraviolet. However, cortisone, corticosteroids, they seem to have a negative impact on light therapy. In other words, the light therapy doesn't seem to be quite as effective when animals have had a cortisone injection or are taking corticosteroids oral. Now, that being said, if it's an injection, wait for a day or two before you start treating, and that usually is okay. If they're taking oral corticosteroids, you can still treat. You may want to increase the treatment time a little bit to counteract the interaction with the light. Don't worry, the light's not going to cause any problems or interfere with the medication per se. It's just that the way the light works with cortisol receptors, it seems to have less of an effect. So you can try that little trick as well too. Now, when you're treating a joint, a knee joint, a hip joint, whatever joint it is of the animal, you want to surround the entire joint with a light pad. If it's a small animal, you can usually bend the array around the entire joint, and therefore that's good. If you're treating a hip of a larger dog, then typically you'll have to do a couple placements to surround the joint. So you might have to treat one area first and then the other area first to treat sort of around that joint. It just depends on the size of your animal that you're treating. Now, if you're treating a post-surgical wound area, then you can wrap the light pad with a transparent plastic wrap and gently hold the pad in place. Typically, the area has been shaved. There might be sutures. That's okay to treat over. If there's a bandage, you can treat over the bandage, but the thing with bandages is that it's going to absorb most of the light. So I kind of prefer to treat around the bandage just to allow some light to get in and around the area for more of a systemic effect. But the bandage itself will block the light from entering into the tissue. Remember that you presumably are also using this equipment. So make sure that and by the way, this isn't just for treating animals and your pets. In between usage with your equipment, you should be maintaining and cleaning your equipment properly. So you can use a 70% alcohol solution on a non-abrasive cloth or towel to wipe down the array and any parts that you might be touching. You can also use a very mild disinfectant. We do not recommend that you're immersing the treatment array in water. It's even though it's hermetically sealed, it's not designed to be washed, with lots of water around. There are some straps. I don't know if you'd be using them or not on an animal. You may, and they are machine washable, so they can just be washed as well too. Okay. So let's get into treating cats and small dog breeds. I'm going to lump these together. So even though some cats might be the size of a medium dog, hopefully not, but they're roughly about the same number of kilograms or pounds, give or take. So when you're treating cats and small dogs, I'm going to ask you to use about 3 minutes of red light, followed by 3 minutes of near infrared light, and using the corresponding human anatomical region. There's a timer on your controller. So what you're going to do is you're going to choose the level. Remember, always start at the level 1 or the lowest level. And then you're going to treat the area for about 3 minutes, watch the timer. And then after about 3 minutes, you're going to take the pad off the area. Now, if you have to treat another area, go ahead and treat that other area. Or if you're just treating one area, let the red light timer tick down until it stops and then automatically turns into near infrared. So you don't need to do anything at this point. Once it turns into near infrared, I mean, you don't need to actually turn anything on the equipment. And then the near infrared, when it switches on, the timer resets, usually for 6 minutes or 8 minutes. Then put it back on that same area and treat with near infrared. So once again, 3 minutes of red, take it off, let it count down to the near infrared, then put it back on and treat with near infrared. Or if you're treating 2 areas, then red light, and then near infrared light and near infrared light. For roughly 6 minutes in one area, give or take. Now, again, you might want to increase that if the fur or the skin is dark. But if it's more white or a lighter color, then you don't need to do that. So you can wrap the light pad around the area being treated, but I'm going to just ask you not to excessively squeeze or bend the treatment array. Now, the way these things are designed is that the LEDs are embedded in a flexible sort of, I don't know what it's called, but it's like a flexible sort of cloth medium, you might say. It's not a cloth, but it's allowed to bend. I think it's actually nylon, or I think. But, you know, with excessive bending, just like anything, it's going to fatigue. So don't really yank on it and really bend it. Just be gentle with it and try and make as good skin contact with the area as possible. You can treat several areas at the same time. So sometimes, you know, if you're treating the lower back, you're going to be treating the upper back, and maybe that's what you want to do, and that's okay anyhow. But it just depends on what areas you're treating. So if you want to treat both hips on a cat and you have a longer array, you could probably wrap it around both hips and treat both hips at the same time, which is perfectly fine. Okay, so medium and large dog breeds. The largest dog I've had is you saw a black lab and yellow lab. I haven't had anything much bigger, but that's considered a medium breed dog. So these guys are quite a bit larger and therefore will require slightly different strategy. I'm going to suggest you treat with about 5 minutes of red light and 5 minutes of near infrared. And you might say, wow, that's getting pretty close to humans. True, but remember earlier I mentioned that I've taken into consideration the fact that more light will be reflected or not absorbed because of the fur and because of darker skin, for example. So therefore, that counterbalances with being closer to a human protocol, but not quite. Okay. So similarly to the cat and small dog, watch the timer. When it hits about 5 minutes, take it off, let it cycle through the red light. And then when it starts to cycle through to the near infrared light, put it back on the same area to treat that area as well. Okay, so exactly the same you treat as a cat and a small dog, but you're going to be holding it for a little bit longer in one spot, about 5 minutes. Okay, so wow, that half an hour goes by fast. I should probably make these webinars longer, but I don't know. I find sometimes our attention spans after about half an hour start to diminish. Well, mine anyhow. But so next webinar is on treating wrist sprains and fractures with. No, that's not the next one. Ooh. That was on February 23rd. Well, you know what? Guess what? You're going to have to check our website because clearly that was wrong. I thought I updated that. However, I know this is right. I'm going out to Vancouver March the 25th to do a light up your practice for healthcare professionals on the use of light therapy in their clinical practice. Guest speakers are Dr. Pierre Delorier, a chiropractor, a longtime BIOFLEX user, a really dynamic and fun speaker, along with Dr. Lauren Brown, a traditional Chinese medical doctor, an expert in fertility and integrating laser therapy into an acupuncturist and TCM practitioner. So if you're in the Vancouver area, or maybe just want to visit us and head out to Vancouver, sign up on our website. It's pretty reasonable. It's a whole day event, and you get to see some of our new devices and new products. That's on Saturday, March the 25th. I'm doing the same thing again in Ottawa, April 22nd, but we'll be having as a guest speaker, instead of Dr. Lauren Brown and Pierre, we'll be having other guest speakers there. All right, I see you have some questions, so let's take a look. I think I answered the one about the intensity of light. It differs according to the anatomical region and the actual treatment level. 15-year-old yellow lab, Commodore, I love that spelling too, is diagnosed with geriatric vestibular disease, weighs 40 kilos. What can the BIOFLEX help her with? Well, I'm assuming you're asking about the vestibular disease. Hard to say, but I would treat over the ear. It's worth a try. We have treated tinnitus and Meniere's and some inner ear disorders, but it all depends on the location. There can be different locations, including inside the brain and the cranial nerves. It's hard to say exactly, but it certainly wouldn't hurt. So you can give that a try, Laurel. Can BIOFLEX treat non-cancerous cutaneous hemangiomas, wart-like bumps on my 45-pound Keeshond? Anything non-cancerous is fine to treat. I'm not exactly sure it's going to do much for hemangioma, which is a non-cancerous tumor. To be honest, again, you can try, but I don't think it's indicated for hemangioma. So I'm not sure it's going to do a lot for that, Judy. A question from Helen. I have a 21-year-old cat. Wow, with kidney disease. Yeah. That's always problematic in cats. Still asking food every couple of hours. Oh man, I tell you, some cats are so food driven. It's insane. This new cat I have, Simba, he is insanely food driven. Whereas my other cats, depending, they were not so much like that. She also has arthritis in her front paw and hind legs. I was worried about the laser being too strong for her to use. Okay, try over the kidneys. There's some anecdotal research in animals actually that it might help kidney disease, so that's safe to use. And no, it's not contraindicated even though she's older and she has these other health problems. As I just treat as I've suggested, Helen, and hopefully it helps out. So I have here a question from Dahlia about using the professional system. Yeah, for sure. I mean, most of the time I've been using professional systems for veterinary uses. And the question is about experimenting on a cat for arthritis in her ankles and old back injury. Want to know how to use it appropriately and how to adjust the intensity to make up for the fur that's obstructing the light due to some degree. Yeah, so when you're using the professional system, similarly, as I suggested, use the same time frame for the arrays. And then for the laser probe, you're going to want it for, in the case for a cat, you're going to take it down to about 20%, 10-20% power, and then treat it like you would a human. So you're taking the power right down and move it back and forth, the laser probe, to splay the fur and try and make good skin contact. So hopefully that helps out. Do you need to worry about red light with treating the mouth area after dental? I'm not sure I understand that question. I don't think you do. Yeah, I don't really understand why you'd be concerned about red light. In fact, it should help any inflammatory issues post-dental work. But Janice, maybe you can kind of just explain that a little bit more. A question here, I have a dog with tarsal arthrodesis. I should know how to pronounce that. It's just issue with the joint. 2 weeks, she is currently in a cast. When the cast is removed, I would love to know the protocol for treatment, currently treating with MagnaWave. I'm assuming MagnaWave is a pen for a pulse electromagnetic device. Yeah, exactly. So you should be able to treat your dog, no issues, once that cast is removed, and just use the guidelines that I've mentioned, Lindy. And if you have any further follow-up or you want to further questions, email me. My email is below, david@bioflexlaser.com. Are there any cardiac applications for using the array? I'm assuming you mean on veterinary use. Not directly, but, and it's not necessarily contraindicated to treat in and around the chest area where the heart is. And if the question is, would it help with cardiovascular disease? I don't know about that. It's probably doubtful, although there's some anecdotal evidence to suggest that photobiomodulation therapy might be helpful for arteriosclerosis and hypertension. But this is all pretty experimental and, not, I wouldn't say it's been proven, but because there's no downside to trying it, and I know Dr. Khan was a big advocate of that, it would be okay to try, but I'm not going to, indicate its efficacy. What happens if you keep the laser or the light on longer than you want? Just recommended for dogs. That's a good point. Light therapy is what follows a biphasic dose response. A lot of people think the more dosage, the better. But when you think about it, it acts like a drug. And in essence, with a drug, you want to get the right dosage. If you double the dosage, you could create harm. If you cut the dosage in half, you might not have any effect. So for photobiomodulation, there is a dosage range that's going to be effective. And if you do excessive dosage, your benefits are decreased. In fact, they can be even detrimental temporarily to some degree. So I don't recommend overdosing an animal or yourself. Is it best to treat a dog standing or lying down? I don't think it really matters, but I think it's easier to have the dog lying down. But some dogs can gently, stand there and you can treat. It doesn't matter. Although I would say when they're lying down, their muscles aren't contracting, which may make it a little bit more effective. What if your dog has tumors, but not in the area that you're treating? Is it still recommended to use the device? As long as you're not treating over the cancer, you can use the device. It's not contraindicated. Interested in treatment for renal failure for cats and geriatric onset laryngeal paralysis for dogs. So Pauline, for the kidneys, I mentioned earlier that there's some research that's showing that it might have a positive effect on the kidneys. So you can treat over the kidneys just using the protocol for the thoracic or mid-back area overlying the kidneys, and see if that's helpful. For laryngeal paralysis, that's a great question. I mean, I don't know what the cause of that would be, but you could treat over the larynx safely on your dog using the neck protocol. I don't know if it would help because I don't know what the cause of the paralysis is, but it may be helpful. My dog has tarsal, didn't we just talk about tarsal? Tarsal arthrodesis, 40-pound English setter. Right, so that's, I believe, Lindy, that's your dog in the cast, right? If I'm not mistaken. I forget what I was supposed to answer with that one. Can you treat trigger points on dog legs? What would you recommend for laser protocols? So for trigger points, I usually use a laser probe to treat trigger points. But if you just have the array, then you would just use the array over the trigger points. and that may be helpful, but I would also still use your hand to treat them as well. What about psychological conditions? One of my cats has a lot of fear. Would be great to find out anything to make her more relaxed. Yeah, I know cats are finicky. Well, actually, all animals like humans can be a little have some issues. I don't know what to say with that one because there's so many reasons for that. Oftentimes, it's what they experience socializing, where their background, where they came from, or things that happened to them. So it's hard to say, and I can't really promise or even would know what to do with that for the psychological issues. Other than light therapy seems to relax the animal, so you can treat around the neck and the head safely and see if they're chill about it. Maybe that might be helpful, but I don't have a lot of experience with that one. For professional systems, do you ever worry about eye exposure? That's a good point. I didn't mention about the eyes because for the home systems, there's no issue. For the professional system, we use a class 3B laser probe, which technically might be an issue for the exposed eye. So as a practitioner, you're going to wear the glasses. For the dog or the cat, cats, forget about it. Dogs, you could put on goggles or safety glasses. They're usually pretty good about it. But to be honest, when you're using the probe, it only turns on when you make contact with the skin. So it's pretty safe. Unless you're treating around the cranial area, then you'd want to make sure the eyes are protected. What about general health of an animal? Just like in humans, I would treat over the belly, the abdomen, to help with overall systemic inflammation. And a question from Suzanne. Mentioned about a manual for veterinarians. Is it accessible to pet owners to use? Sort of. It's a professional manual. I think there was a cost to it. So Laura, if you're interested, I don't know what it is, but Laura, email me and I'll see what I can do. How do you treat dental on a dog? Do you put the laser on the lips? Do you have to put in the actual gums? Yeah, you're not going to. Oh, so for dental applications, you can treat around the cheeks. Some of that lead will go into the oral cavity, and that's actually very helpful. For in the oral cavity, if you have a laser, you can actually trigger it and hold it while you're in the oral cavity to some degree, and use it that way. But that's only for the professional system. My Sheltie was attacked by a moose. Oh my, how to treat post-surgical laceration repair. Wow. I actually initially thought I read that as mouse. And I said, ooh, a moose is a different story. So post-surgical laceration repair, Rebecca, do you mind, Rebecca Sartorius? So Rebecca, is that your real last name? Because if it is, that's interesting surname. Rebecca, email me and I'll help you out with the protocol for post-surgical application. You guys have lots of questions. Thyroid condition is in a cat contraindication for its use. If your cat has hypothyroidism, you can use it, Suzanne, but you're gonna have to email me about that. But for hyper, no. Can you use a laser probe with a personal system? No, a laser probe is a class 3 medical device, and it is technically a restricted device because it's a medical device, which means that it has to be used by a qualified medical healthcare professional. Otherwise, we lose our license. So yeah, can't do that. Question about dosing. Hi, Wendy. Nice to hear from you. How has it been determined that overdosing can have a negative effect? Was it testing on mice? Oh, that's a great question. So, Wendy, if you want to email me or remind me, just email me reminder about the biphasic dose response papers and how they determine that. There's one really good one that I gave an example, and I do this in training, and it had to do with tendinitis on rats. And what they found is when they doubled the dose, the beneficial effects of the light therapy, the infrared, was nil. So it didn't have as much of a good benefit. And as far as a negative effect, that's where the light actually starts to have an effect on like when it starts to get heated up. Like I know you use class 4. You can imagine if you have that class 4 on too long, then that heat generated by that light will start to create a negative effect. Because you're heating up cells. Cells don't like to be heated up, and that can have a detrimental effect, which is why when you have a fever, you want to get that fever down, because the fever is there to kill pathogens, but it can have a detrimental effect on the cells. But I can send you some papers on that. How would you protect the eyes? So on dogs, the glasses, they're usually pretty good with wearing them. And like I say, if you're using the professional system and the laser probe, it's really only a concern for the practitioner. So put them on. For the animal, for a cat, it doesn't turn on until you hit the tissue. So it's usually pretty safe. But for dogs, you know, that are able to, you can put the goggles on. But because our devices only trigger on when they touch skin, it's a built-in safety feature. Except again, always the practitioner needs to wear the glasses, and preferably the patient. But in animals, we recognize that that might be difficult for a cat, for example, in which case you need to be just super careful if you're using the probe. Comment on the psychological effects for cats. Laurette mentioned about maybe doing Reiki for animals. Again, you know, there's lots of things that you can do, and that might be one of them as far as helping animals therapeutic-wise for mental health issues. Okay, so Wendy, I'm confused about the dosing topic. I've always had better results with high dosing. I would like to understand this better. Okay, so high dosing will provide an analgesic effect. So if you high dose, you'll get immediate benefit and everyone feels great. For photobiomodulation effect, that is the effect on the mitochondria, high dosing out of a certain range will not give you better effects, which is why if you want to combine class 4 and class 3B is great. Class 4 is going to give you analgesic effect, but it won't provide photobiomodulation. That's why every paper published on photobiomodulation, it uses class 3B or lower for photobiomodulation effects. That is the mitochondrial effects and the effects that I talk about. For class 4, it inhibits the axonal flow of sensory and pain nerve fibers and provides temporary relief of pain. When you dial down class 4 or treat it very quickly, you can get dosaging for photobiomodulation. That's true. But if you use class 4 where you're getting a higher dosage, then you're going to get more of an analgesic or blocking effect, Wendy. Okay, last one here. My veterinarian called at the exact moment you were answering my questions about the tarsal arthrodesis surgery. Robin is a 2-year-old setter. Ran under an RTV, ouch, fractured metatarsal, did damage to the hock. I'm treating her with PEMF, which is good. Okay, so I'd love the manual for animals. Lindy, can you email me? I don't have any way to access this after. Lindy, if you're listening, just email me at david@BiOFLEX Laser. Thank you so much. All right, that's it, folks. Everyone have a great day, and we'll see you next time. Thank you.